Hi, my name is Matthew Neal, and I'm an assistant professor of surgery and critical care medicine at the University of Pittsburgh. I'm a trauma surgeon in my clinical practice, and I run a translational research group focused on understanding the mechanisms of hemostasis and coagulation disturbance after trauma and hemorrhagic shock. I would argue that I have the most intellectually stimulating and invigorating job in academic medicine. As a trauma surgeon scientist, I faced some of the most vexing clinical problems on a daily basis in my clinical practice, and then I take these challenging problems to the laboratory. Injury is the leading cause of death for persons under the age of 45, and death due to hemorrhage is the leading cause of preventable death following injury. After completing a 3-year postdoctoral fellowship in the middle of my training here in Pittsburgh, I was faced with the prospect of putting my science on hold for at least 3 years until I joined the faculty. My department chair generously supported my ongoing laboratory efforts with money for technical support and lab costs while I completed my clinical training. This let me hit the ground running with an established team and laboratory when I began my faculty position 2.5 years ago. This fast-track approach was coupled with incredible faculty mentorship, both during the final years of training and as junior faculty, with ample protected time for research. In my current faculty role, I balance a busy clinical practice in trauma, emergency, and elective general surgery with my research efforts. Doing so requires intense commitment, energy, and organization. However, I find that my lab inspires my clinical practice, and my patients serve both as profound motivation, but also an invaluable resource for advancing our studies, as my lab plays a large role in a number of ongoing clinical research trials where we analyze patient samples alongside clinical outcomes. The key to success has been to build a highly motivated team of individuals who share my passion for the science behind our clinical care. And this has come to fruition only because of a department and a school of medicine that have committed unwavering support to the development of surgical science.